Knock, knock.
Come in.
Mr. Jones. Hi there. My name's Tiffany. I'm going to be your nurse today. You doing okay?
Yeah.
Alrighty. Hold on one second, Mr. Jones, because I left my order sheet outside of the room.
Okay.
Let me bring it back. Okay. Alright, so my name's Tiffany. I'll be your nurse today, and I'm here to change your central line dressing. I have some orders over here from the doctor. So before we get started, I'm going to go ahead and wash my hands, get some hand sanitizer. I'm going to provide privacy. So I've got this curtain, and I'm going to pull that curtain around. Alright, Mr. Jones, can you tell me your name and date of birth?
George M. Jones, 101XX.
Yes, and his bracelet, your bracelet matches, so George M. Jones, 101XX. We have a standing order to perform sterile central line dressing change weekly and as needed, okay? So, it looks like it's been changed a little over a week ago, so it's time to be changed again. All right. Mr. Jones, are you allergic to any cleansing agents like chlorhexidine or alcohol, sponges?
No, not that I know of.
All right, so I'm gonna go ahead and lay you supine for this procedure. It will be a sterile procedure. Okay. I'm gonna raise your head up a little, your bed up to working height. I want you flat for the insertion to decrease that pressure in your chest. Okay, then I need to put your feet down. You okay?
Yeah.
All right. So we're gonna change this central line dressing because to prevent infection, so it should be changed every 7 weeks. I'm gonna go ahead and put this rail down too.
7 days.
Yes, every 7 days. Thank you, Mr. Jones.
You're welcome.
It's been a long shift. All right, let's see here. So first thing, I've asked you about the allergies. So you already got your head turned away, but you need your head turned away from the insertion site so you don't breathe any microorganisms on the area. I'm gonna place a mask on. Do you think you'll be comfortable like that for just a few moments?
Yeah, I think so.
Okay. I'll put my mask on, and then I'm gonna wash my hands again because I've touched a few things, so might as well. Make sure it really gets rubbed in and dry. Get me some gloves. So taking off the dresser, Mr. Jones, is not sterile, but we want to make sure we are careful when we do it. So, because we're about to open up that area where the central line goes in.
Okay.
My hand is sweaty and sanitizer. Okay, so I'm gonna go ahead, and there's actually kind of like a little slit at the bottom that he's got a dislocated shoulder here, but you know. All right, there's a little, when you're trying to take this off where it's stuck together, there's a little slit that you can pull, but it got underneath his shoulder here. Okay, so I'm going to take it off. I'm going to go ahead and loosen up the edges. I'm going to maneuver it around and pull it away from me and towards the insertion site. So I kind of follow those arrows right there. It's really stuck. Okay. All right, I'm going to examine my dressing, which is now torn into little pieces. All right, I'm looking for any drainage. I'm looking at the site for redness, drainage, foul odor. It looks good, Mr. Jones. We just need to change it to keep it looking good and prevent infection. So I'm going to go ahead and open this up. I'm being careful not to touch the actual insertion site. I'm going to take that off. I'm going to lay it back down here. Okay. All right, Mr. Jones. Now I've got that off. I'm going to take off my gloves. I'm going to wash my hands again. And I'm going to get ready and open my sterile packages and put the new dressing on.
Okay.
Alrighty. So, I'm actually going to put this here and this here. Go ahead and open this away from me. Okay. This one. being careful not to touch the inside. I can stay on that 1-inch border on the outside. I'm opening it away from me. Okay, if it slides off like that, I'm gonna just try to kind of gently maneuver it back on. Because I'm still just touching the packaging. Nothing's open like yet. All right, now I'm gonna go ahead and take this out. I'm gonna drop it. I don't need it. He's got his head turned away, so let's get on our sterile glove. I'm gonna put him over here on the bed. Okay, Mr. Jones, I'm gonna use your bed for a minute.
Okay.
I'm not turning my back on my sterile field. I'm not reaching over it. I'm gonna do it right here. I'm gonna open these up. Okay. Make sure my hands are good and dry. I'm gonna pinch this one. And I'm usually not like a medium, so. All right, and then I'm gonna scoop this one. Okay. All right, now I'm sterile, and I want this kind of out of the way, so I'm just gonna kind of flick it. Use my feet. So I've got everything open now. I'm gonna go ahead, and I don't need this either. You can use this, but you don't have to. I'm gonna get rid of that. Alcohol swab. I would probably have my trash can right here, but it's fine. All right, chlorhexidine sponge, and I'm gonna go ahead and grab this as well. Just in case. I think I just need one of them. Okay. All right, so I'm gonna go ahead and break the sponge. Everything I'm touching is still sterile, so breaking the sponge, and you don't have to break it, but all right, so I'm gonna use this gauze here, and I'm gonna lift up. I'm being careful not to touch anything else. So I'm gonna scrub in a back and forth motion for 20 seconds, getting around the insertion site, scrubbing the tubing, real good, scrubbing this area. Okay, I'm scrubbing it 20 seconds, back and forth motion. All right. Then I let it air dry, okay? We don't want to fan, we don't want to blow it, anything like that. All right, so I'm gonna go ahead and get rid of this. So I'm done, I'm gonna hold on to this just in case if I need it. So the first thing I'm gonna put on is my securement device. So I'm gonna grab my securement device. Now, actually, I don't think I need this because it's gonna be too hard to use it. So I'm gonna put it down. I'm gonna take the back off, so I'm not touching the back. I try to hold this little plastic piece in the front when I take it off. I'm gonna take it off. All right, and now, so I've got this, I'm gonna go ahead and, I've already cleaned it, so it's still sterile, everything's sticking up. I'm gonna use this hand, I'm gonna go ahead and reach up under it. I'm gonna make sure I don't put it too close because it's not gonna go in there, so I kind of have to go back a little bit. So you kind of use your eyes a little bit. But go ahead and place it down. All right, so I'm gonna go ahead and place it down, and I'm gonna loop it through. And this actually used to be a quadruple PICC line, and it's not now. See, I might have it now. We can make it work. So try to loop them in there. I'm gonna use this hand as well, but it's not gonna fit quite right, but so there we go. So I got them in there, and then you're gonna take this right here and pull this bottom, and you kind of use your other finger as a guide, and well, just kind of tape it across. All right, like I said, you don't want to get too close. So see right here, I got a little bit close, but you don't want it too close where you can't get all the wires in there. Okay, so now I've got that. So the last piece here is going to be my dressing. I'm going to go ahead and pick this up here. I'm just going to be careful when I open it not to touch the back, anything like that. So and you can use that paper to kind of guide you a little bit. I'm just going to do it like this. not like a one-handed person, but try to do it one-handed. As long as I'm touching the paper, it's fine. Okay, so the jelly is where you're going to put it right over directly that insertion site there, because that's got that antimicrobial in it. So you're going to just kind of eyeball it, but you want it lined up. All right, that's it. Okay, so once it falls, you're just going to let it fall. I'm going to really, you want to make sure you really squeezing it around the edges, make sure it really fits good. So that's all covered. Okay, so now not worried about being sterile, so it's all nice and clean and covered, and it's been sterilized. So I'm gonna go ahead and get this off here. So I'm gonna use, usually I like to start with this one. It's gonna work. Oh. Well, just don't want to come up. There we go. Okay, so this is gonna be my name and date, so I'm gonna put it here for a second, and then I'm gonna get this side. Okay, this piece goes up underneath it, creates another barrier, so you go up underneath it with it and get it kind of tight on there, and then just kind of morph it to the dressing. That keeps the bottom closed too. So, and then you're gonna take this off. Okay, I'm gonna get my label here, date, time, initial. So it's 6/10/25. It's 1 p.m. and TW. Okay. And you can really put this one in a couple places. Some people put it across. You can put it on the side. You just don't want to ever cover where you can see. You always want to be able to see that insertion site. So we'll just do it like this, but not a right or wrong for that. Okay. All right, Mr. Jones, we are all done. So you can put your head back to the middle. Sorry you had to keep your head turned so long and I made a mess, but I'm gonna clean up my supplies. That I put on the floor. So ideally I would have my trash can a little bit closer and I could just drop it, but don't worry about risking sterility if you have trash. Just drop it on the floor. All right, Mr. Jones, I'm gonna cover you back up. You can put your head back here. I'm gonna go ahead and fix your gown. I'm gonna lower your bed. All the way back down. Give your table back. Okay. Do you want to sit back up or are you good?
I'm all right.
Okay. So now once I've done all that, I'm gonna take off my gloves. I'm gonna take off my mask. I'm gonna wash my hands. All right. And make sure you have your call light within reach, Mr. Jones. I don't see him, but I'm gonna make sure you have your call light. Okay. Bed is lowered, locked. Table's in reach. All right. Thank you, Mr. Jones. And I'm gonna document.